Welcome to our project, Enhancing Anesthesia Practice, an educational initiative to enhance knowledge and confidence in neuraxial dexmedetomidine use. We have 4 presenters, Emmy Charlot, Ana Laureano, Caroline Otuque, and Natasha Williams. By the end of the presentation, anesthesia providers will demonstrate a 10% increase in knowledge regarding dexmedetomidine benefits as measured by a pre- and post-education assessment. By the end of this evidence-based presentation, providers will indicate a 10% increased likelihood of utilizing dexmedetomidine in their practice as measured by a pre- and a post-assessment. Here we discuss the mechanism of action of dexmedetomidine. It is an alpha-2 agonist and it decreases norepinephrine release. By doing this, it has 2 effects. It produces sedation through the locus coeruleus and it produces analgesia through the spinal dorsal horn inhibition.
Looking at Precedex clinically, one of the biggest things that stands out is the quality of the block. Pain control is better and lasts longer. That means patients go longer before needing additional analgesia. In obstetrics, that becomes even more important since opioid use is reduced without affecting the baby. Another consistent finding across studies is how stable these patients are on Precedex, less vasopressor use and smoother sedation. And it's not just intra-op. These effects actually carry over into recovery. Overall, patient comfort tends to be better with less respiratory depression compared to opioids. There's also evidence showing improved post-op recovery, including better neurocognitive function. And from a safety standpoint, ABGAR scores remain unchanged, which is reassuring. These clinical benefits are reflected in data. Compared to fentanyl, Precedex gives similar or better pain control but with fewer side effects. It kicks in faster, lasts longer, which is exactly what is needed, especially in C-sections and ortho cases. And since it provides both analgesia and sedation, Precedex fits really well into the multimodal approach. And these findings are consistent across multiple studies and neuraxial techniques. This is pretty cool because this is where numbers explain what is being seen clinically. SMD, or standardized mean difference, shows how big the difference is between groups. Negative values mean faster onset. Positive values mean longer duration. So in this study, Precedex led to faster onset, longer blocks, less shivering, without any changes in ABGAR scores. So overall, it improved block performance without added risks.
For the supportive studies, we had a study that we reviewed where fentanyl was compared to dexmedetomidine, and it was found that dexmedetomidine provided a longer duration of analgesic coverage compared to fentanyl. Dexmedetomidine was also found to have a stable sensory block as compared to fentanyl. It was found that it provided a greater duration of sensory block of up to 27 minutes longer compared to fentanyl. So overall, on this slide right here, it shows that dexmedetomidine compared to fentanyl provided a longer pain-free period, which is one of the reasons why we are advocating and teaching for the use of dexmedetomidine as an alternative to opioids. Dexmedetomidine has been known to have a very favorable safety profile. One of the big things is that it does not cause respiratory depression. However, there's been issues and concerns about bradycardia and hypotension. Therefore, it's important to be mindful of the dose selection and monitoring when this is administered to the patient. There are various clinical applications that we can use dexmedetomidine for. It can be used in multimodal analgesia. It's best supported as an adjunct and not a standalone anesthetic. And we also have to consider what surgical procedure the patient is having and the risk factors before we administer dexmedetomidine.
Based on studies, the general recommendations for dosing is not to exceed 0.2 mics per kg for spinals and 0.5 to 1 mic per kg for epidurals, and this tends to reduce any side effects. Also, you want to monitor your patient closely, heart rate and blood pressure, and titrate your dosing accordingly. The typical dexmedetomidine dose for spinals is 3 to 15 micrograms, which improves block quality and duration. And for epidurals, it's normally 0.5 to 1 mic per kilogram, which is going to prolong your labor or surgical analgesia. In conclusion, dexmedetomidine prolongs sensory block and postoperative analgesia when it's used as an adjuvant with local anesthetics. You can also reduce opioid requirements in the peri-op setting, which is going to lower the incidence of opioid-related side effects such as pruritus, nausea and vomiting, and respiratory depression. You want to monitor the patient for dose-dependent bradycardia and hypotension, and also just consider any patient-specific factors and surgical context before deciding to use Neuraxial dexmedetomidine. This concludes our presentation. We want to thank you for your time. We ask that you please scan the QR code for the assessment and complete the post-education assessment form. Also, if you're interested in any of our articles that were used for this PowerPoint, you're able to scan the QR code for the references. Again, thank you, and hopefully we provided education that will be beneficial to you in your practice.